Senator WELLSTONE is very gracious and allows his friend from the House to begin.
Well, I think you've been there.
Okay, and as I mentioned, there was just a vote in the House a moment ago, and I expect some other members from the House to be here. Today, the United States is facing a severe crisis in the price of prescription drugs. Every person in this room and in this country knows that there are millions of Americans who cannot afford the cost of prescription drugs. There are doctors who no longer write out prescriptions because their patients don't have the money to buy the drugs that they prescribe. At the same time, the United States continues to have by far the highest prices in the world for prescription drugs, the exact same drugs, with the same prescription drugs often sold in this country for 35 to 50% more than they are sold abroad. I was just in Italy the other day. The same drugs, they pay 50% of what we pay. Meanwhile, while ill people cannot afford the prescription drugs they need, the pharmaceutical industry last year raked in $27 billion in profits, more than any other industry. And in order to maintain those profits, they spent hundreds of millions of dollars over the last 3 years on lobbying, on campaign contributions, and on advertising. And the result of their efforts is to make sure that they continue to have the highest profits in the world despite the needs of the American people. Those of us who have been working on this issue, Senator WELLSTONE and myself and others, are gratified that during the last Congress there has at least and at last been a recognition by both political parties about the severity of the problem. That's a step forward. Certainly during the campaign, President Bush raised that issue repeatedly. Having said that, I must express serious disappointment that the President has put forward a very weak proposal that fails to address the real cause of the prescription drug crisis. Key elements of the President's plan ensure that it will provide only limited or no relief for millions and millions of seniors throughout this country. The President's plan includes no guaranteed benefit, so that the help that low-income seniors receive will vary from state to state, as will the amount of copayments and deductibles that they will have to pay. If we ask President Bush today to tell us exactly what the benefits will be, he cannot state that. Secondly, President Bush's plan lacks the critical element of any serious prescription drug solution: cost containment. At the heart of everything is the fact that our people are paying far more than they should for the drugs that they need. President Bush's proposal has nothing to say about that. And without any effective cost containment, programs that the President is proposing are little more than a giveaway to the large pharmaceutical companies. Finally, his plan does not address the absurdity of the current situation, whereby Americans are paying, in some cases, up to 10 times more for the same exact drugs than our people in Canada, Mexico, and elsewhere. Let's be clear what the President is proposing. He is putting forward a short-term plan which will end in just 4 years. Under his plan, states would receive federal money to help low-income seniors afford prescription drugs. Only individual seniors making under $15,000 and couples making $20,000 per year will receive any benefit at all under that plan. And only individual seniors earning $11,660 or less will receive 100% of the benefit. What that means is that if you are an individual senior making $16,000 or a couple making $21,000, the Bush plan provides no benefit to you at all unless your drug costs exceed $6,000 a year, which is only 1% of Medicare beneficiaries. Bush's plan, which will sunset after 4 years, gives states 3 years to set up their individual programs, so in some cases, no senior will get any benefit for 3 years, and then it will only last for a year. In truth, by putting out a $48 billion 4-year Band-Aid plan that leaves millions of seniors with no relief, President Bush is acknowledging that during his first term in office, there will be no comprehensive prescription drug reform. That is what he is saying. And I think the American people deserve a lot more than that. Even if he gets a second term, the long-term approach that he's providing will allow seniors a 25% subsidy to buy private drug coverage from an insurance company. Many of those private plans have premiums of up to $1,000 and limit the coverage they provide to anywhere from $1,000 to $3,000. Also important to note, the cost of these Medigap plans have been zooming upward in recent years. It is quite possible that in 4 years, despite the subsidy, seniors will be asked to pay more for those Medigap plans than they're paying today. Bottom line, in terms of President Bush's proposal, there is no strong cost containment component. The president's proposals will still leave the American people paying by far the highest prices for prescription drugs of any country on earth. To help seniors purchase Medigap insurance policies with no cost containment is little more than a government giveaway to the insurance and pharmaceutical industries. Now, let me talk for a moment about the proposal that many of us are working on. And that is a serious plan that provides serious relief from the outrageously high cost of prescription drugs in this country. Under the Progressive Caucus Medicare extension of drugs to seniors meds plan, seniors will get the kind of coverage and cost containment they need, and all Americans, even those who are not on Medicare, will benefit. Meds is a voluntary program within the Medicare system. On the meds, when fully phased in over 5 years, our clearly and nationally defined benefits will result in no senior in this country having to pay more than $1,600 out of pocket per year. President Bush would leave them paying $6,000. Very simply, meds would cover 80% of the first $5,000 in prescription drug costs for all seniors who choose to participate in the program, and 100% after that. For that benefit, seniors would pay a premium of about $25 per month in the first year and about $50 when fully phased in year 5. Low-income seniors would have no premium or co-payment cost. Now, you might ask a fair question. How can meds provide such comprehensive and excellent coverage? Is our proposal going to bankrupt the United States government? And the answer is that we can provide this excellent coverage because we are serious about cost containment. We are serious about lowering the cost of prescription drugs in this country for everyone, and we are serious about taking on the pharmaceutical industry with all of their lobbyists, with all of their campaign contributions. Briefly stated, the first cost containment program item is to plug the loopholes in last year's reimportation bill so that prescription drug distributors and pharmacists can, in fact, purchase prescription drugs that are FDA approved from any country on earth. Second of all, meds would require that any medication sold under the program be made available at the best price that drug companies offer anyone else, similar to what the Allen proposal, which was introduced last year, would do. And finally, our proposal includes reasonable pricing language that requires that drugs developed at taxpayer expense be sold at reasonable prices to the consumers who pay to develop them. Bottom line is, if you have the guts to take on the pharmaceutical industry, you can lower the cost of prescription drugs for everybody and the government, and in doing that, provide universal, inexpensive coverage to every senior citizen in this country. And I'm delighted to be working with all of the members here who have played such an active role in fighting for seniors on this issue. Thank you. Let me introduce Paul WELLSTONE, who's been a champion of this in the Senate.
I'm going to be brief because we've got a lot of people here, and I'd like to thank everybody. I'd like to thank journalists for being here as well. I think that, first of all, I'll be very brief about the President's plan. I feel I'm emotional about this issue. 65% of the senior citizens in Minnesota don't have any health care prescription drug coverage at all, 65%. And I had a mother and father, both of whom had Parkinson's disease, and I saw what these costs were. And therefore, it seems to me if we're going to be talking about helping people, it can't just be symbolic. I mean, we have to really have proposals that meet the need. And I see that the President's proposal, I think, is a great leap sideways. a great leap sideways. I mean, many people, just because you make $16,000 a year or $20,000 a year, or a little bit over that as a couple, doesn't mean with the prescription drug costs as they are, that you can afford it. The whole point of this is to make it part of Medicare, to make it universal, and to meet the need. And I just would like to say a couple things about this proposal. First of all, Bernie's point is so important. We're talking about a copay of 20% up to the first, as it's phased in over 5 years for the first $5,000. And after that, not a copay. And then in addition, we're talking about a premium. So altogether, the most you pay is $1,600. And under the president's proposal, what is it again, Bernie? What do people ultimately end up having to pay?
$6,000.
$6,000. So it's comprehensive, and it really helps people. I mean, you keep the co-pays down, and then after $5,000, you cover the costs, and people can afford prescription drugs. That's what this should be about. President Bush's proposal is empty. It does not meet the need. And frankly, I think it invites mutiny, because when people see this in the country and realize it doesn't do that much for them, there will be a lot of indignation. People do not want to see us play symbolic politics with their lives. Last point, how to pay for it. And again, I think what all of us are saying here today is there are 3 ways to do this. First and foremost, if this is part of Medicare, which has been such a successful program, then you've got the bargaining power of 39 million people. The pharmaceutical industry doesn't want to see discount. They don't want to see the bargaining. They don't want to see the leverage, but that's the way the VA does it, and that's the way we should do it for Medicare recipients. There has to be cost containment, and that's the first principle. The second principle is when NIH does the good research, at the point at which the license is handed over to the pharmaceutical company, there is absolutely no reason why there cannot be a contract that calls upon the pharmaceutical companies to charge a reasonable price. And then third of all, the drug reimportation bill that we've all talked about without loopholes is yet another cost containment. The way we have priced this out is if we do the cost containment, then we can provide really comprehensive coverage for people. And that's what people in Minnesota are waiting for. That's what they're asking for. That's what they believe we should be about. But you got to be willing to take on the pharmaceutical industry. You got to be on the side of the people, your constituents, not on the side of this industry. This administration doesn't want to take on the pharmaceutical industry, doesn't want to challenge any of their prerogatives, doesn't want to do any cost containment, and that's why what they have laid out is such a weak proposal that doesn't even come close to meeting the glaring need in Minnesota and in the country. This proposal does respond to that need. This is real. This makes a huge difference, and we're going to fight for it. There'll be votes on the floor of the Senate on this proposal. I guarantee you that.
I'm Sherrod Brown. I represent Ohio's 13th District in Northeast Ohio. This nation has a problem. Medicare lacks drug coverage. Low-income Medicare beneficiaries are not the only Americans affected. Far from it. Half of those without coverage are middle income. No current Medicare beneficiary has guaranteed coverage. With eroding employer-based Medigap, Medicare Plus Choice coverage, fewer Medicare beneficiaries in the future, as we're seeing every day, will have coverage. If you have a family member in Medicare, you're affected too. It's a national problem. Fortunately, Medicare beneficiaries are no longer being ignored. Policymakers on both sides of the aisle recognize that the prescription drug problem is real. Unfortunately, there are still those who would minimize the problem by establishing 50 state welfare programs that only help the lowest income seniors. They would procrastinate by delaying the next solution for 4 more years. To ignore more than half of those who need drug coverage is at best to pay lip service to the problem. At worst, it's an easy way out that shows an astounding lack of compassion for literally millions of retired Americans. Worst of all, the new administration's made clear that if Medicare beneficiaries want prescription drug coverage, they're going to have to agree to a complete overhaul of Medicare, probably a voucher program that would undercut the Medicare guarantee in favor of the private insurance market. Privatizing Medicare, which is what they want to do and have been saying for years, would take a huge burden off Congress and off the federal government. But it's not in the best interest of Medicare beneficiaries and not in the best interest of Medicare beneficiaries' families. The prescription drug industry is lobbying to turn Medicare over to private insurance because they know that segmenting the Medicare population will make it difficult to use the buying power of Medicare to achieve lower prescription drug prices. Drug company profits outpace those of any other industry in America by 5 percentage points, no matter how you measure it. Return on assets, return on investment, return on equity. They pour millions into political campaigns. They pour millions more into front groups whose sole purpose is to demonize Medicare and demonize a Medicare prescription drug plan. And they pour still more millions into image advertising bent on depicting their industry as attuned to the average needs, to the needs of the average senior citizen. The drug industry is attuned to one thing and one thing only: profits. The message we're sending today is that there's a right way to address the prescription drug problem. It has nothing to do with what makes life easier for federal lawmakers and nothing to do with what makes life easier for drug manufacturers. The right way to address the lack of prescription drug coverage is to provide current and future Medicare beneficiaries with a meaningful prescription drug plan under Medicare, to keep costs in check by demanding lower prices from the industry, and to do it now. My job as the lead Democrat on the Commerce Health Subcommittee is to translate these principles into law. I look forward to working with everyone from the Progressive Caucus, working with other Democrats in the House and Senate, and working with people on the other side of the aisle to give real prescription drug coverage for Medicare.
Good afternoon. I'm Barbara Lee. I represent the 9th Congressional District of California. Several months ago, actually it was about a year ago, many of us conducted studies in our districts to look at the price differential for prescription drugs for our senior citizens on Medicare versus those on preferred types of insurance plans. What I found in my district was that with the top 5 prescription drugs, which seniors frequently use, there was approximately 131% price differential on those top 5 drugs. We also found that many senior citizens oftentimes, more times than not, choose between food or medicine every month, depending on what they need and how they can afford to survive for that month. So this is a very serious issue. It's an issue that is not a partisan issue. It should be an issue to unify us. I don't believe that pitting low-income poor seniors against seniors who may not be so poor is a unifying initiative. $6,000 out-of-pocket drug costs is outrageous for many, many senior citizens in our country. What we're proposing in terms of the Medicare extension of drugs to seniors plan would actually modernize and strengthen Medicare, as well as create an affordable prescription drug benefit program that will expand the accessibility and autonomy of all Medicare patients. Currently, Medicare offers a very limited prescription drug benefit plan for the 39 million aged and disabled persons who depend on its services. Many of these beneficiaries have to supplement their Medicare health insurance program with a private or public health insurance plan in order to just cover the astronomical costs that are not actually covered by Medicare. Here today, we understand now that we're looking at a country with over $1 trillion surplus. My question to the president is, with this surplus and with the discussions with regard to tax cuts, especially tax cuts for those who are wealthy, why are we leaving our seniors behind with a real sham of a proposal? It's wrong and it's bad policy. I think with this $1 trillion surplus, we have enough in our country to cover prescription drug benefits for all of our senior citizens. I want to thank my colleagues in the Progressive Caucus and all of our colleagues who are working very diligently and have been for several years to make sure that people in this country understand that we are not forgetting our senior citizens in our budget debates and in our policy debates here in Washington. The quality of life continues to deteriorate for our citizens while we're here debating what type of prescription drug benefit we should provide for them. I say today that we should provide all of our senior citizens with a Medicare prescription drug benefit, such as the Medicare Extension of Drugs to Seniors Plan, which we're discussing today. So let's stop gambling with the lives of Medicare patients and really support a plan to strengthen and modernize our Medicare system. Thank you very much. I appreciate being able to be part of this press conference today.
The administration's policy here is disgustingly weak. It's the equivalent of telling someone to take 2 aspirins and see you in the morning. It's a giant, as Paul has said, leap sideways. It's not going to solve the questions that we're concerned with. I want to congratulate Dennis and KUCINICH, of course, and then Bernie Sanders for their leadership on this, and Paul WELLSTONE for his leadership, and all of the other members of the Progressive Caucus who are with us today. This is comprehensive, it's strong, it's 80-20, it's not 50-50. It deals with the problem of closing the loophole on importation, which are huge, the Mexico piece, as well as the contract part of that law that's very, very weak, and the labeling concerns that we have with that loophole law. So that is addressed here. The cost containment is addressed. It's a good bill. It's really what the American people want, and we're going to press for this as hard as we can because it's the right thing to do. We ought to, as we have just heard from Barbara, be able to find the resources in such a humongous budget surplus to deal with some really basic needs that people have. And I thank my progressive colleagues for the opportunity to say a few words to you this afternoon.
Good afternoon. I'm Maurice HINCHEY. I represent the 26th Congressional District in New York. As we all know, medical science has been revolutionized in the last several decades. Conditions that were formerly treated by surgery and sometimes radical surgery are now treated by prescription drugs. That is a good thing. It has improved health care availability for people all over the world. But the fact of the matter is that many Americans do not have access to that health care, and the reason for that is that the cost of prescription drugs is too high. Take, for example, a standard prescription drug that is administered for breast cancer. Rather than the kind of surgery that was often used in the past, breast cancer can now be treated in some circumstances by this prescription drug. You can buy the prescription drug in France for 50% of what it is available for in the United States. You can buy the same prescription drug in Italy for 30% of what it is available to patients here in the United States. This is simply wrong. These prescriptions were developed, most of them, the research and development went through the National Institutes of Health and other federally subsidized research institutions at universities and other similar venues around the country. But Americans have subsidized the development of these prescription drugs, and now they're paying by orders of magnitude more than people in other countries around the world. It is simply unreasonable, it's unfair, and the quality of health of our citizens is lower as a result of these conditions. So the legislation that we're talking about here this afternoon obviously would deal with this in the most comprehensive, the most effective, and the least costly way. It makes health care available to Americans at a reasonable cost, similar to the way it is available to people all around the world in other countries. And it's about time that we did that. So the passage of this legislation obviously is needed, and as my friends and colleagues have said, it is so much better, far superior to that which has been proposed by the administration. And clearly we are going to fight very hard on behalf of all the people whose health is at stake and whose longevity is at stake so that they can get the prescription drugs they need to maintain their health and their lives.
Good afternoon. I'm Congressman Gerald Nadler of the 8th District of New York. Senator WELLSTONE and my colleagues have laid out the details of the proposal very well, so I won't be redundant. But I'd like to make 3 basic points about expanding prescription drugs coverage for seniors. First of all, it is simply the right thing to do. As we all know, at least 1/3 of all Medicare beneficiaries have inadequate or unreliable coverage. This is at a time when the average senior pays nearly $1,000 a year for prescriptions, forcing too many of them into poverty. Clearly, there is a need for universal coverage for prescription drugs, and now is the time to provide it. The second point I want to make is that if we're going to add this benefit to Medicare, we should do so right away. We should do so the right way. I do not believe that either the Republican plan advanced last year or the plan offered yesterday by President Bush is a serious attempt to solve this problem. Each suffers from fatal flaws that would leave millions of seniors with inadequate coverage or no coverage at all. The Bush plan in particular is an insult to American seniors. It would exclude nearly 3/4 of all seniors, including almost half of all the uninsured, from its coverage. The Bush plan would have no defined benefit or premium and would hand over responsibility to the states, who have shown little success in this area so far. The Bush plan is not a helping hand. It's more like a slap in the face. The president says it's a temporary program until we devise a long-term solution. But today we're here to present a real plan and a long-term solution today for comprehensive coverage that can be implemented now. Now, the Democratic plan put forth in the last Congress was a strong framework, but we do not feel it went far enough. The 50% co-payment included in the plan would continue to leave too many seniors with exorbitant drug bills. We have to go further, and this plan proposes an 80% government payment for the cost of drugs, and the enrollee would pay only 20%. We should do this not only because it is the right thing to do, but in the end, keeping people healthy reduces premiums for all of us. Finally, I want to say that a strong, comprehensive prescription drug benefit is affordable and achievable through the cost-saving measures contained in this bill that have been discussed by my colleagues. By addressing the price discrimination indulged in or engaged in by the pharmaceutical companies against American citizens, against Americans on Medicare in particular, and using the leverage of large-scale purchases to negotiate reasonable prices, we can contain costs without stifling the innovation of new pharmaceuticals. Our seniors need relief from the staggering costs of prescription drugs. We need to offer a plan that will make necessary medications accessible and affordable to all, and will do so now and not one of these years when somebody else proposes a different plan. I believe this bill will do that. Simply put, adding a comprehensive prescription drug benefit to Medicare is the right thing to do, but we have to do it the right way, the way that covers everybody, a way that will work, a way that can be implemented right away, and we can do so. Thank you very much.
Thank you very much for being here. As I'm Dennis KUCINICH from Ohio, and I represent the Cleveland area. I'm also the newly elected chair of the Progressive Caucus. Congresswoman Barbara Lee is the vice chair of the caucus. I want to thank all of you for being here. And I think it's important to set the context of this conference here today. The Progressive Caucus intends to meet with you regularly to demonstrate that we're ready to provide realistic, workable alternatives to some of the policy initiatives coming out of the White House. And we're here this morning as a caucus with the support we're so grateful of David BONIOR, of Sherrod Brown, of Senator WELLSTONE, and others, to stand up for real prescription drug relief for all Americans. And that is a big difference from the administration's plan. Drug prices are expected to go up 17.5% this year, the most commonly used drugs at twice the rate of inflation. In a report published by Health Affairs, it found that drug spending is growing so fast, it is the biggest factor pushing up the cost of health care, accounting for 44% of the increase in health care. That's why so many people across the country are becoming desperate over this issue of the rising cost of prescription drugs. Now, this administration solution that's been offered is charitably could be called a non-solution. At best, it will only help a few seniors and will give them only a little bit of help. The administration's drug plan does nothing to help non-Medicare beneficiaries or taxpayers. The Progressive Caucus proposes reimportation of the same prescription drugs at lower prices from other countries. Both Democrats and Republicans, members of Congress and the Senate, have endorsed this idea last year. The leadership of Bernie Sanders was instrumental in pushing this to the forefront, and we should pass it this year. The Progressive Caucus proposes helping every Medicare beneficiary and reducing prices for every other American. I want to say that again. The Progressive Caucus proposes helping every Medicare beneficiary and reducing prices for every other American. The Bush plan covers only single seniors making under $15,700 per year or couples earning less than $20,000 per year. You know it and I know it, that this is an economic dilemma that reaches into every household in this country. And it deserves a response which is commensurate with the economic challenge which is facing so many American families. Americans deserve real relief. The average American pays 50% more than for a prescription drug, same drug, in England. 50% more, 75% more, same drug, 75% more than France. 100% more than people pay in Italy for the same drug. Now, Americans have a right to ask, why are these people in other countries paying so little for the drugs that Americans are paying so much for? The prescription drug companies are inflating prices for American citizens and are reaping $27 billion annually in profits from this practice. The next 4 years, as we hear it, are supposed to be the beginning of bipartisan cooperation. We're all excited about that. Let's start now. Let's pass the Congressional Progressive Caucus's strong prescription drug benefit and price reduction bill without any loopholes. It's time to enact meaningful prescription drug benefits for Medicare beneficiaries and to knock down the cost of prescription drugs for every other taxpayer. And I want to thank all of you again for being here, and you'll be hearing more about our efforts. Thank you.
Thank you. Any questions? Yeah.
Can you walk us through some of the specifics of your latest proposal that are addressing those loopholes that caused Secretary Villela to tank the last bill? And secondly, can you give us an idea of the cost to Medicare? I know that most of the money for this program comes from cost savings through drug reimportation, but is there any cost to the Medicare program in subsidies, and how much is that?
And also, just don't forget the discount, similar to what the VA does, which I think is key.
All right, let me pick up what Paul just said. 3 areas where we are fighting for cost containment. Very common sense. Number 1, Dennis just said this, why should the American people pay twice of what the Italians pay for the same exact drug? We live in a globalized economy. Everybody here believes, not me, but other people believe in unlimited free trade. Everything you're wearing and your TVs come from God knows where. Why not FDA-approved prescription drugs? You do that and make sure that you have real competition around the world, we can lower the cost of prescription drugs to every American and the United States government 30 to 50%. Very simple. Number 2, every corporation in America knows that you use and you leverage bulk purchasing. General Electric pays a lower price than the corner grocery store, the corner store, for what it purchases because it purchases a massive amount. The United States government purchases huge amounts of prescription drugs through the DOD, the VA, Medicaid. Why don't we use the bulk purchasing capabilities to do that? Third area, and I got to tell you this, the House passed legislation to allow us to do this, and that is the United States government every year spends billions and billions of dollars to develop new drugs through the NIH. And then what we do is after we develop the drug, we give it over to the private drug company and they sell it to our people at any price they want. If you have reasonable pricing attached to that type of subsidy, you could save substantial sums of money. Do those 3 things. You drive the cost of prescription drugs way, way down, okay? And then what we're saying is with all of those savings, you have the capability of providing a strong benefit, not 50-50. Not what Bush is talking about, but an 80-20, benefit, which will provide real relief to millions of Americans on Medicare, and in fact, millions of Americans who are not on Medicare, because the cost of prescription drug goes down. So in other words, because we are saving substantial sums of money, the government can provide that kind of generous benefit.
So there's no new spending through the Medicare program that's necessary for this program?
We haven't priced this thing out exactly, but because of the enormous savings through our cost containment efforts, we can provide that benefits, I believe, without any more spending than any other proposal.
Can I just quickly follow up to what Bernie said? I think we will cost it out, but I think what we can say today, conceptually, is that the irony, and let's hope it's not a bitter irony, is that if you do the cost containment for roughly speaking the same cost as what President Bush is talking about, except that his proposal doesn't cover most of the senior citizens, you can provide comprehensive coverage with low co-payments so that it's affordable. But you have to be willing to be serious about bumping up against some of the prerogatives of the pharmaceutical industry. And I will tell you, they don't want to see this as a part of Medicare. You all know that. And part of the reason is because of just the whole potential of discount buying and bargaining, the same way it's done. I tell you, I'm in veterans medical centers all the time. Talk to veterans about the drug benefit. That's one of the most important things to them about the coverage. They're able to get their prescription drugs at a cost that they can afford. Well, we can do that for Medicare recipients as well. So I think that I think this proposal will be met with a tremendous amount of support around the country. I think we're going to have to take on some powerful economic interests here, but I think that if you were to, I haven't taken my poll, but I just would tell you, in any coffee shop in Minnesota, people would be very interested in making sure that it's good coverage that they can afford, and they would have no problem with discount buying for Medicare recipients, no problem with the reimportation, and no problem with what we talked about with NIH.
I'm confused. You're saying that Medicare is going to cover this, cover drugs, but there's going to be no new Medicare spending.
I said two things. I said we haven't costed out, but generically I think you could almost say that probably for not much more, and maybe the same price as what the president's talking about in his proposal, we can do this because we have the cost containment. I mean, there's a direct, it's a direct correlation. If you're willing to do the cost containment, then you can provide the comprehensive and affordable coverage. If you're not willing to take on the prerogatives of the pharmaceutical industry, then you're going to have to do it like President Bush is doing, which is means tests, not universal, doesn't cover most of the Medicare recipients, and doesn't provide the help that people need. It's that simple.
So of course there's going to be increased spending, but what Paul is saying, if we're paying substantially, if we're buying a product for 50%, you can cover twice as many people.
And the other piece of it,
Just taking money from the surplus.
Sure.
and the other piece of it is just that. You cannot, I've said it before, and so some of you all will smile, you've heard it before, but this old Yiddish proverb I like so much about not being able to dance at two weddings at the same time. In all due respect, you're not going to be able to do the $1.5 trillion with whatever CBO gives you by way of estimate, and the tax extenders, and Star Wars, and additional Pentagon spending, and the interest you're going to have to pay, and meet your commitments to Social Security, and meet your commitments to Medicare. You won't be able to provide a decent prescription drug benefit for senior citizens. But guess what? People in the country are under the impression that we're going to do something to meet their need, and that's what this proposal says.
Can I, let me add something. Last year, the Democratic minority, unfortunately, the Democratic minority proposed a prescription drug benefit not as comprehensive as this. It was a 50% copayment. It was a 50% copayment. Too much.
Too much.
It also had none of the price-saving mechanisms in this. None. The total cost of that over 10 years would have been, if memory serves, you can all check your own files, probably about $190 billion over 10 years. We also figured at that time if we made it an 80% copay, so that people only paid 20% and did none of the cost savings, the additional cost would be about $270 billion. The total cost, in other words, if without any of what we're proposing, don't do any of the cost savings, the total cost of an 80% government pay, Medicare paying prescription drug program is far less than the cost of abolishing the estate tax, for example, which is $500 billion over 10 years. So we have choices to make. You could decide, have a smaller tax cut, and out of the surplus fund a good prescription drug program. But we're not proposing that. We're saying, why should the drug companies continue to profiteer unduly? Let them have normal, decent profits, but why should they profiteer unduly based on taxpayer-funded research, based on gouging Americans with prices much higher than they charge the same drug to foreigners, and based on no discount pricing because of leverage of Medicare buying the drugs? If you do those three things, then you can have everything else, because then your cost isn't what I was saying. It's much, much less. But the point is, even if you do no cost savings, it's not all that much compared to the size of the surplus. You might not be able to totally repeal the estate tax.
Other questions? Yes, sir.
I'm not hearing any specific hard numbers yet attached to this. I mean, are you planning to come up with some hard figures?
That's a good question, and the answer is we don't have them at this point.
When do you anticipate that?
As soon as the bill is introduced.
And when?
Very shortly. It's a fair question, and we will have that. Karen?
Yeah, Congressman, if the folks in New York and Vermont and Minnesota are reading this and they say, this is a great idea, I really want this, realistically, what chance do you have of getting it through Congress with the leadership that you're dealing with and with the White House you're dealing with?
I think we have an excellent chance, because I think we're going to make the White House and Republican leadership an offer they can't refuse. And that is, we're going to go out to grassroots America, where people already know that they're getting ripped off royally, that they can't afford the cost of prescription drugs, that the pharmaceutical industry is making huge profits. We're going to expose the Bush proposal, and we think because our Republican friends are good politicians and they're going to want to get reelected, we think they're going to have to move substantially away from where they are today. I would remind all of you that 2 years ago, when we and others were talking about this crisis, our Republican friends had nothing to say about it. Now they have a proposal. It is a very weak proposal. But if we do our job right, expose what they have brought forth, rally the American people, I think we're going to do something very, very substantial.
That's a good way to end. What's the other question?
Yep.
Do you expect you'll have any Republican co-sponsors?
I certainly would hope so, yes. At this point, you sure we're progressive Democrats and myself, but I would look forward to Republicans.
I think it's got I think on the Senate side, I'm going to be working hard to try. I can think of a number of people. I don't want to commit them right now, but I do think it's got a lot of appeal, political appeal, because it's such a compelling problem, such a compelling issue to people's lives, and I think it meets with such approval around the country. The question is whether or not we can translate that to what we do here, and we're going to make every effort to do so.
And its basic tenets are pretty conservative and market-oriented, right? So good Republican conservatives should feel comfortable about coming on board. Yeah.
Question about reimportation. What specifically does this plan do to plug the loopholes of the...
Let me just mention four of them very briefly. We give you some paper on that if you want. Number one, everybody here must understand that the pharmaceutical industry is extraordinarily aggressive. They sue, they lobby, they spend millions of dollars on advertising at the drop of a hat. The current reimportation legislation would allow them to say that, yeah, the law says you can reimport, but guess what, reimporter? You cannot charge in the United States a price that is any lower than what we in the pharmaceutical industry are charging today. That is a huge loophole. Obviously, our legislation contains language that eliminates that. Second of all, the current reimportation legislation does not mandate that the pharmaceutical industry has got to provide FDA-approved labels to the reimporter. So right now, if you have a product coming in from Canada or from Italy, the reimporter cannot use FDA-approved labeling, which basically makes it impossible to sell the product in the United States. Thirdly, there are countries that are not involved in the reimportation process. Mexico, for example, is not part of those countries that under current legislation a reimporter could buy the product from. And fourthly, there is a 5-year sunset which has a number of problems associated with it. Yeah.
Question to that.
does this mean that, I mean, the law is not in effect now because Shalala didn't implement it. Does this mean you're also going to have to accompany this with a request to Bush, to the Bush administration to implement the law with these amendments?
Well, what we are talking about is legislation that would contain language to plug these loopholes. So we have the good news is that we have a reimportation legislation. The bad news is it contains loopholes. This bill, among the other things that we talked about, would plug those loopholes.
Right, but doesn't the administration still need to request the money to start the process to...
Well, we hope to pass by the bill that we are presenting to you today is legislation that, if adopted, would of course include money for the inspectors that we need.
You're talking about not just plugging the loopholes in the current law that has not been implemented, an entirely new reimportation law as part of the bill?
No, we're talking about a broader law that contains other elements that we all talked about today. Within the context of reimportation, we're going to plug the loopholes. Are you with me?
Still not sure how it's going to work with the existing law that's on the books.
It would make the existing law workable and would direct the administration to implement it.
There you go, Jerry. Okay? All right, thank you all very much.
Thank you.